The consultation is the most important appointment if you want a busy, thriving cosmetic dental career. And over the past 4 or 5 years, I have learned and still learning these 7 crucial skills that have allowed me to do over 1,000 cosmetic dental cases. When I was a younger dentist and I was on the NHS doing loads of NHS, I used to eventually get private consultations, and I used to feel really nervous, a little bit scared, a little bit anxious whenever I used to have consultations. And I always used to think back, why did I used to feel this way? And maybe you feel the same way as well. And one of the reasons was because I just didn't have that many. And I've done all these courses and I was doing loads of NHS. And when I eventually got 1 or 2 consultations, I was so desperate to try and take advantage of them and try and get that opportunity to do some treatment that just increased the pressure of each and every one of them. 2 is that I didn't have that self-confidence in myself. I didn't have that self-belief because I was inexperienced. I didn't have that much experience clinically. And because of that, I found it very hard to almost communicate to the patient my ability to help them, because I had no evidence of my ability to help them because I didn't do that much treatment back then. And the 3rd thing is just inexperience. As you know, the more you do certain things, the more confident you get. And I had not done many consultations, and that is why I used to feel them feelings of anxiety and nervousness. But to be honest, I used to just ignore it. And I never really spent time improving my ability to carry out effective consultations. I used to just focus on trying to get better clinically, until I realized that to get better clinically, I have to actually treat patients. And I wasn't treating any patients because whenever I got consultations, I just gave off a vibe that patients didn't trust me. I gave off a vibe that patients didn't believe that I could help them. And so I wasn't able to do the treatments that I needed to get good at those treatments. And that is why I said, you know what, I need to try and develop skills. I need to try and break down the skills, first of all, involved in the consultation, and then try to improve my ability to carry out these consultations so that I can become a better dentist. So as years went on and I learned the skills, it just takes time, and I started getting more experience in consultations. I started becoming better at them. Patients used to trust me a lot more. I used to get more conversions, more treatment. And as you start doing more, you start getting better. And to the point now where consultations are fun. I love talking to new patients, finding out their story, building rapport with them, and trying to communicate the value that we can provide and try and helping them. And then, you know, it's almost like a game to try and be able to not convince them, but try to instill belief in them that we are the best dentist for them to get the treatment and the goals that they want to do with their smile. So without further ado, let's get into it. The first skill that I wanted to talk about is your mindset. And this is something that I still do to this day. Every time I have a consultation, I make sure that I fix my mindset and my intention. And I suffered from not doing this when I was first starting out, and I alluded to it earlier in the video. When I was first starting out, I was so desperate to try and convert that patient and get the treatment because I wanted the experience. It wasn't even the money back then, if I'm being honest. It was just the ability to practice private dentistry was so appealing to me. But I wasn't there to try and help the patient. And this is what I mean by intention. Now, when I have a consultation, I'll make sure in my own mind that my main focus, my sole focus, is to help the patient. Whether they go for treatment or not, it shouldn't really matter. My main focus is just to help them. And the funny thing is, as you fix your intent, people can sense it. It comes across in your verbal, non-verbal communication, in your tone of voice, your body language. And humans have a canny ability to sense another person's intent. And if you fix your intent, the patient can then trust you a lot more because they know that you have their best interests at heart. The second skill that you need is more of a belief, and it's a belief in yourself. If you have belief in yourself and your abilities to help the patient achieve their goals, then you are more able to transfer that belief into the patient. Because that's what you're almost doing when you're communicating with the patient, when you're trying to sell a treatment almost, is you're transferring that belief so that the patient believes that you're the best person for the job. But you can't do that if you don't believe in yourself. So you need to have that first. And there's a couple of different ways of doing it. One way, which is probably not the way that I would advise and not as sustainable, is to delude yourself. Self-delusion can almost get yourself to a point where you believe in yourself more than what you probably should. But it's very difficult to do, and I couldn't do that. And this was another motivation for me to try and get better clinically, is because as I got better clinically and there was more and more proof, there was more evidence of me doing a good job and more happier patients coming in to see me after I've had treatment, I just developed that belief in myself. And now the small amount of treatments that I carry out, I'm very good at, and I'm very confident in saying that I'm very good at. Generally, I'm not very good at a lot of things in dentistry, but the things that I do, I'm very good at. And because I have this belief, again, it comes across in when I'm speaking to the patient, and I'm better able to transfer that belief into the patient. And so it really helps me in my ability to communicate with the patient, and like I said, transfer that belief so that they believe in it. Number 3 is rapport building, and this is crucial because a patient won't trust you, a patient won't buy from you if they don't like you. You have to come across as likable, and it's a skill. Trust me, there's a lot of people who are not likable in general, maybe me, but you can develop the activities that are required to come across as likable. Simple stuff like saying the patient's name, making eye contact, smiling genuinely when you see them, asking open-ended, genuine questions about them and being interested in them. These simple things that you should be doing at the start of a consultation, it should just be a habit right now. And you can use these things to help you become more likable, build rapport, and ultimately the main goal behind this, similar to the intention thing, is to make sure that the patient trusts you in that consultation. So the 4th skill required for effective consultations is asking questions. And it's asking the right question and asking it in the right way. And if you are able to do this, then you can open up the patient, and the more emotion that the patient reveals to you, the better equipped you will be at communicating the value that you have in the treatments that you have. And I do think that if a patient goes to 2 dentists and they open up more emotionally to one dentist than the other dentist because of the questions that that dentist has asked, then they're more inclined to trust that dentist as well. Because in a consultation environment, in a sales environment, the patient won't really believe anything that you say. They're not stupid. They all have a bit of skepticism with them. They'll know that you're trying to help them, but you've got a vested interest to try and get them to have the treatment with you. They're not stupid. So they always listen to you with a bit of skepticism. But if they start communicating the reason why they want treatment and the issues that they've had and how long it's affected them and how it emotionally negatively affects them and how they're worried about this and that, they're almost selling the treatment themselves, and all you have to do is just sit there and listen to them. And that is one of the key things with consultations. And when I look back at consultations that have gone really well, I actually realized that I've talked about 20%, 25% of the time. And if the consultation has not gone well, I've done too much talking. So if you can get the patient to talk more and you just ask simple questions, good questions in the right way, and when I say right way, I mean in the right tone, so it comes across you're genuinely interested in them, then you're able to be effective at opening the patient up. Number 5 is clear communication. In a consultation, obviously the bulk of the work is communicating, being able to speak to the patient. The nice thing about it is, like I just mentioned before, is the patient's going to be doing most of the talking if you've done your job correctly. But there obviously is going to be a point where you need to talk and you need to explain and make the patient understand the treatments that you're doing or the treatments that you propose to them and why it will help them and why it will positively impact their lives, or whatever it is that they've said, how the treatment is going to positively affect them. And you also have to explain the actual procedure. The more information that they have, the more likely, again, that they're going to trust you and the more likely that they're going to uptake the treatment. But it's not just communicating more and more and more. There is a way that you can communicate, and actually I'm not that good at it, you're probably realizing whilst watching this video, but communicating in a very clear way so it's easy to understand, not using any jargon words that, I mean, we have a very bad habit as dentists of using jargon, but as soon as you do that and patients are confused, they don't understand, then the chances of them kind of buying or trusting you just goes to zero. It's very, very, very small. So you have to be able to accurately, clearly communicate the value that you are proposing to them and why it's going to help them. so that they understand. And if they clearly understand how it's going to affect them, then they are more inclined to trust you and uptake treatment. 6 is a skill that is a little bit more clinical. I think the skills that I've talked about so far have been like mindset and communication skills, but number 6 is photography. Photography is so important, and it is just a type of communication. I don't know, what's that saying that goes, a picture paints 1,000 words. If you've got photography, if you can take good photos, it can help do a lot of the work for you. And I'm talking about taking photos of the patient's teeth and smile and face, and you can show that on a screen, and that can just sell the treatment themselves, and that can actually show the patient how bad their teeth are, for example. And then also photography that you've done in the past and showing that and how you can got before and afters. All I'm trying to say is that if you can develop the skill of photography and you're able to display that to the patient during the consultations, it will certainly help your argument in the patient needing and wanting the treatment of you, the dentist. And the last skill for effective consultations, and this is the most important skill, if you can develop this skill, it'll kind of make the other skills not as important. This skill is the art of listening, and the art of deep listening. So important. And like I said before, you're going to be, if you've doing your job correctly, you're going to be talking only 20% of the time, and the other 80% the patient's going to be talking, and you have to listen. And I am terrible at this, and people, if you talk to people in my life, they'll tell you I am such a bad listener. But I'm aware of the importance of listening, and because I'm aware of it, I understand that I'm trying to get better at it. And you might be thinking, how can you get better at listening? Don't you just sit there and listen? It's easier said than done, trust me. I think the skill is just sitting there, being very patient, being present with the patient, and listening to every single word that they're saying, not thinking about anything else, listening to the words that they're saying, listening to the emotions behind the words as well. And as well as listening to the feelings behind the patient's words, you're also using your eyes too. You're looking at any facial expressions, you're looking at their body language, and you're trying to almost read between the lines. And the thing is, this skill is very rare, and it's very hard to find someone who actually listens to people properly. And if you're able to do this, it'll do a lot of things. It will make you come across as a lot more likable, and I mentioned this in the building rapport skill. If you can come across more likable, then again, the patient's going to trust you. And simply just sitting there, and the thing is, you don't even have to do anything, you just sit there and listen. And that in and of itself will make you come across as more likable. But it's not only that. If you're able to listen properly, and you'll be able to get more information from the patient, then you're going to be able to communicate the right things, to almost say the right things that's going to be important to them when you're communicating the value that you want to communicate. And you're also going to be able to spot red flags. You know, those patients that say these things, and in hindsight you think, oh, maybe I shouldn't have treated this patient. You know, you always get those patients that you maybe should be a little bit careful of treating because maybe you can't meet their expectations. If you are not listening to the patient properly, and I still sometimes suffer from not doing this because I'm in a rush or got other things on my mind, but I need to try, and you need to try to get into the habit of, when the patient's talking, especially in consultations, but in all appointments, but especially in consultations, sitting there and trying to truly listen to understand what the patient is saying. And that will equip you with more information to be able to communicate exactly what is required for the patient to trust you, believe you, like you, and ultimately be treated by you.